Hello again, everyone. This is Dr. Michael Smith from Holiday Smiles. Today we're going to show you how we do an immediate bridge with the tooth extraction. This particular patient came to her cleaning appointment and we took an x-ray, which is really important that we take every 6 months. It showed that she had a black spot on the x-ray up near the root on her upper front tooth. And we sent her to the endodontist and we found out that she had a fractured tooth. So the patient obviously doesn't want to go without a tooth even for one day. So what we do is we prepare the adjacent teeth for a bridge, and to do that we have to unfortunately reduce the tooth down to a specific shape, and it does entail the front tooth and the back tooth of the tooth being removed. So here you can see me taking a diamond burr and I'm reducing the tooth down to a specific shape, and we leave the tooth that needs to be removed still intact until the end. So the tooth that I'm working on right now, there's a little dark spot on the front of the tooth. It looks like it's decay, but it's actually not. She has a little bit of tetracycline staining, and that's just a little dark band from tetracycline stains. So a dental bridge is basically 3 crowns connected together. So we can't make a bridge immediately after we take out a tooth because we don't know where the gums and the bone will end up. If we do it prematurely, then there will be a gap underneath the fake tooth that rests on the gums, and that every time she eats food, it will get food impaction up underneath the fake tooth. We call that a ponic. So we're checking her bite to make sure there's sufficient reduction of tooth structure. I'm giving her a little bit of an anesthetic boost on that tooth before we remove it. One of the common mistakes that people think is that you pull a tooth, and that's actually not true. You actually push the tooth upward. So this part is where I'm using a periosteal elevator to loosen the gingiva attachment to the tooth. You'd be surprised how tightly bound our gums are to our teeth. There are some cases where a patient has no bone holding the tooth in, yet the tooth is pretty firm, and all because the gums are attaching so firmly. Once we have the gingiva sufficiently loose around the tooth, then we go in with our instrument to perform the extraction. So you will see I will be very delicate. I'm actually pushing upward, I'm not pulling down, and I lightly twist and put a little pressure as I'm pushing upward. What's happening is the bone expands, and you'll see all of a sudden the tooth will become quite loose, and then you can ultimately pull the tooth. There's going to be a little bit of a surprise when you see me take out this tooth, but you have to wait for it. This patient with the fractured root, I'll show it to you in detail and you'll be able to see something on the tooth. I did forget to mention that we did recommend an implant for the patient, but she wanted to do a bridge instead. There are a lot of dentists and specialists that go really quickly and you run the risk of breaking a root off. You can see how the tooth is getting really loose, and now I'm starting to pull the tooth. As you can see, the patient is really relaxed and is not in any pain. Here's the tooth out, and you can see that's an abscess, actually a piece of infection, and the cells actually form a little sac around the end of the tooth, which makes it difficult to get the tooth numb. And you can see it's basically epithelium like our skin cells almost, and the infection's inside. So this is me pushing against the abscess, that soft part. You can see where the root fractured, and I'll spin the tooth over and you'll see me kind of poke into the abscess, but that is an abscess, an infection inside there, and that's epithelium, an epithelial sac around it. On the x-ray you can see the black up in the roots. I'm going to draw it here, and that shows you how big the abscess was. The rest of the teeth next to it, you'll see little black edges up by the edge of the teeth. Those are actually fillings that don't reflect x-ray. There's actually not a cavity. So now I'm going to be performing curettage where you clean out and debride the inside to make sure you get any extra piece of the epithelium or the infection. We always try to rinse it out, make sure we get a good clean blood clot started in there. The next thing I'm going to do is make a temporary. So to do that, I'll gently put a little piece of cotton up inside there just to control some of the bleeding, because I don't want there to get to be a lot of blood inside the temporary bridge. So I'm squirting the temporary material inside an impression that we had previously taken before we did any work. This material dual cures, so it will cure just by chemical cure when you mix the two together, and also you can light cure it. So I place it over her mouth and we put it up all the way in place, and it will restore the original position of her teeth. The only thing that I could have done better on this was the fact that I had only really light bleach material. Her shade is pretty dark, and I usually don't keep in stock darker shade. The patient was really happy with the lighter shade though. So this is me lifting the temporary bridge out, and you'll see a really long end where it kind of went up inside where the tooth was removed, that little piece sticking out. So I'm going to add a little bit of strength, so I'm going to put a little flowable composite in between the teeth, and we'll shine the light on it to set up the composite. So this is shining the curing light on it to set up the flowable composite. So this is one thing that I do different than a lot of other places. I'm not a big fan of temporary crowns because they make the tooth become black while we're waiting for that area to heal. She's going to be wearing this for about 2 months, and if I don't permanently cement the temporary bridge, then when I take it off, it'll be black, and it could cause the other teeth to need root canals. So I'm a big fan of cementing it with permanent cement, and then when she comes back in and the gums and the bone have all healed and she's ready for the permanent bridge, I just cut the temporary bridge off. So right now we're just tack curing the cement so that I can flick it off. If I fully cure that, I'll have to actually cut it off. So we get it in a semi-solid state so I can easily remove. I'll remove it on the back side as well. And then we'll finish full curing and then polish it. It is actually really important to take the time to polish it up nice, because if you leave it rough, which most people do with temporaries, plaque will accumulate on it and the gums will be really inflamed and they'll bleed a lot when you're trying to do the permanent bridge in 2 months. So we're just rinsing that off. With all my videos, remember the patient is not feeling any pain. I have her completely anesthetized around her teeth. This is the final product. The gums will grow over and the bone will also fill in. She'll be back in about 2 months for me to cut that off and make a permanent bridge. Thanks so much for watching. Please like us on Facebook. You can also follow us on Instagram and subscribe to our YouTube channel. Check out our new office at 1212 East, 4500 South, Salt Lake City.